Hello, namaskar, good morning, good afternoon, and good evening, everyone, from wherever you are listening to us. I'm Divya, your host, and welcome to today's FB and Instagram live session. Thank you for joining our live session. Well, if you are Indian origin living in US or your parents are flying from India to US, you do not need to worry about the medical needs. eGlobalDoctors has your back. To all the viewers joining this live from different platforms, we have an exciting announcement. Stay tuned to know more about it. In today's session, we will be exploring and providing more information about laser hair removal with our expert, Dr. Manish Rijhwani. Dr. Manish Rijhwani is a senior consultant dermatologist in Jaipur who has done his MBBS and MD from BJ Medical College, Ahmedabad. He has an experience of nearly 20 years in various fields of dermatology with special interest in lasers. During these years, he has worked at Ministry of Health, Kuwait for 15 years and is presently working as a consultant dermatologist and associate professor at Mahatma Gandhi Medical College and Hospital, Jaipur. He has worked extensively in dermatology, leprosy, dermatosurgery, and has specialized in skin laser treatments. Welcome to the live, doctor. How are you today?
Thank you so much, Divya. Thank you for such a kind introduction.
Thank you, sir.
Thanks for having me on this platform of eGlobalDoctors.
Yes. So, what do you say, doctor? Shall we dive in?
Yeah, we should start.
Let's start with a very quick and common question. Does laser remove hair permanently?
Actually, coming to lasers in laser hair removal, it was previously called as laser hair removal. Nowadays, the terminology has been bit changed to laser hair reduction. So it's not that it removes the hair permanently, but it removes the hair for a very, very long term. So it all depends on the skin type, the type of laser, or any hormonal disturbances in the patient or the female, any menstrual irregularities. So as such, nowadays we call it as laser hair reduction. And usually we get a good amount of laser removal, and that too for a very long period, sometimes for years. It all depends on the patient profile and the hormonal profile and the cause of excessive growth of hair.
Okay. That means it can last up to several months and it might last for years depending on the profile. Okay. So, my next question is, what should I avoid after laser hair removal?
See, there are a few things to be avoided after laser hair removal. Main is the avoid sun exposure. So after the laser, the skin becomes little reddish, it becomes bit sensitive. So better to avoid the sun exposure, which will induce much more of erythema or redness. And if exposure is too much, it may lead to pigmentary changes over the skin. So this is the most important precaution that should be taken post laser. Other things that patient should care of is not to scratch the area where the laser has been done, to avoid a very hot bath for at least 24 hours, not to use makeup for another 2 days, not to use medications that the patient or the person was using over the face or the area where the lasering was done, not to use any creams other than the creams suggested by the treating physician. So these are the few important things that the patient should take care. He should not go for swimming for at least 2 days. So the idea is to use all the precautions so that we get the good results without having any sort of complications over the treated skin.
Okay, that's really amazing. Let me remind to our viewers that we are live on FB as well as on Instagram and also on YouTube. So hop on your favorite social media. We are exploring about laser hair removal with our specialist, Dr. Manish. So doctor, if pregnant or feeding is laser safe, or what if I'm taking any medications?
As such, scientifically, laser can be done in pregnant or breastfeeding individuals, but usually it's not an emergency procedure as such. So usually on day-to-day practice or clinical practice, we avoid doing laser hair removal in pregnancy, also in breastfeeding. So it can be carried on after the delivery. So as such, these cosmetic procedures are not that emergency. So ideally, it should be properly planned and done when the patient is not pregnant or not breastfeeding. Otherwise, uh, from the clinical point of view, academic point of view, it seems to be safe to do laser in any individual. About the medications, it's very important. There are certain medications which causes photosensitivity. That means sensitivity to the sun increases after taking certain medications. So these medications should be avoided at least for 2 weeks before going for laser, and after laser also for some time. So certain antibiotics like doxycycline and other drugs like isotretinoin, these should be avoided while on laser hair treatment, laser hair removal treatment.
Okay, that means use of laser during pregnancy is safe, but it's not an emergency, so we can get the laser after the delivery.
Yeah, better to avoid
Yeah,
it. Usually we don't
yeah.
recommend during pregnancy, but as
Okay.
such, it's not a nuclear radiation or radiation something which may harm the fetus. But on day-to-day practice, we don't go for lasers in pregnancy and related conditions for medical legal purpose.
Okay. Let's move to our next question. Are there any prerequisites prior starting laser sessions?
See, there are certain very important prerequisites. The first and foremost is the skin should not be, the hair should not be plucked, or waxing should not be done before the laser procedure. So it should be avoided at least 2 to 3 weeks before going for laser hair procedure. And other cosmetic procedures should not be done on the skin where we are going to lace for a laser hair removal. So two important things are there. Thirdly, again, sun exposure should be avoided because sun exposure would lead to tanning, and in a tanned skin, we try to avoid going for laser hair removal as the complications may increase in a tanned skin if we go for laser hair removal. So these are the few precautions that should be taken. Mainly the exposure to the sun should be avoided, and the hair should not be plugged, or threading should not be done, or waxing should not be done.
Okay,
Ideally, we go for laser. Just we advise the patient to shave the skin a day before laser. So we need the hair for laser to be effective.
Okay, we need to avoid the sun exposure and the waxing before the laser. Okay. eGlobalDoctor is one complete healthcare platform solution for all your medical related issues and questions. And मजे की बात ये है that you have these services available to you at your fingertips without breaking your bank balance and without driving all in the comfort of your living room. Doctor, how much does laser hair removal cost or the laser hair reduction?
So about the cost, it depends on the area where we are going for laser hair treatment. So in India, usually it is divided over the face or the axilla, bikini area, or the limbs, or the trunk, or the full body treatment. So it all depends. It ranges from 3,000 to 50,000 for the whole body.
Okay, that means it depends on the area we are getting.
It depends on the area.
Yeah.
Yes, right.
Okay. So as we talked about the laser hair removal cost, my next question is, does laser hair removal expose me to cancer?
Yeah, that's a myth as such, as we have spoken already, that it's not a radiation, as the term laser includes radiation. So it's not a radiation which causes harm to the baby, as we already spoke in cases of pregnancy, or to the skin. So there are no chances of cancer as such post laser. So it's a safe procedure. It's one of the most practiced cosmetic procedure all over the world, and where you have never seen any case of cancer occurring post laser.
Okay. So audience, laser hair removal is safe and it will not cause any cancer as it includes the radiation.
it excludes the radiation that we
excludes
see
the
in terms
radiation.
of
Doctor.
not the type of nuclear radiation or the other types of radiation which harms the skin.
Harms the skin. Okay. That means it excludes the radiation which harms the skin.
It's a light therapy as such, which is a very specific wavelength that we are using. It just is absorbed by the hair follicle, hair shaft, and it destroys the hair root without affecting the surrounding skin. So it's a very safe procedure, nothing to worry about. Only thing is that the practicing dermatologist should be qualified and should have a good experience over the laser technology. And if this procedure is carried out under guidance of a qualified dermatologist.
Okay. As we talked about the cancer, to all the viewers joining this live, I would like to introduce a new product we have launched on our platform, Cancer Care. Through Cancer Care, we are providing second medical opinion for cancer with expert doctors from USA, UK, India, Australia, and Canada. Now you can book your appointment for you or your loved ones. Visit eGlobalDoctors.com. So doctor, is laser hair removal is better than waxing?
See, waxing as such is being practiced since long, and it's a bit painful procedure, and only it delays the regrowth of hair. So here, all of the hairs, they come back definitely, but it delays the regrowth of the hair. On the other hand, laser hair removal or laser hair reduction is almost permanent as such. So in each and every session, around 40% of the hair are destroyed. They don't regrow. So in 6 to 8 sessions, we get rid of almost 95% of hairs, and the remaining hairs that regrow are thinner and lighter in color. So definitely there is no comparison between laser hair reduction and waxing. It's almost a permanent reduction of hair. And even if there is regrowth of hair, whatever the cause, it may be hormonal or if the lasing was not done with proper fluids, we can take maintenance therapy regularly for controlling the hair growth.
Okay, that means laser hair reduction lasts for a much longer period than the waxing. So better option to go
definitely
for
a better
it.
one.
Yeah.
It's almost a permanent one. Only few hairs that come out are lighter and thinner, so they are not that visible.
So doctor, what are some do's and don'ts once laser treatment is started?
It's almost the same thing we discussed before. Do's are that the area after laser or before laser should at least for 3 weeks not to go for waxing, threading, plucking. At least 2 to 3 days, better not to apply any creams or medications over the area that will be treated. And a day or two before, not to go for any harsh procedure over the area that will be treated. And post laser, better to avoid pricking or scratching over the site, not to take hot baths, not to go for swimming for few days, not to apply any other medication that other than the medications being prescribed by the treating physician. Avoid sun for at least 2 to 3 weeks before procedure, 2 to 3 weeks post procedure. So if we follow all these rules, we'll get an excellent result without any sort of complication.
Okay. My next question is, am I an ideal candidate for laser hair reduction?
See, ideal candidate for laser hair reduction, when we get the best result is the person with a white skin and dark hair. So these are the ideal candidates where the skin is white and the hairs are terminal dark hairs. So we get excellent results. In our type of skin, we are a bit darker, so the contrast is there. So we use laser. There are many types of laser that we use for laser hair reduction. So I'll go a bit into it. So one is Alexandrite laser. That is usually we use in the whiter type of skin. It's an ideal laser for a person having white skin and the dark hair. Then there is a diode laser. Usually we are using diode laser in our setup in India, in the Indian type of skin. So it has a good absorption and it avoids any sort of complication as such. And the third laser is the ND-arc laser. So these lasers deeper and are much safer, but then they are not that effective. So in Indian context, in our type of skin, we are using diode lasers. And nowadays, we are getting a combination of all three lasers in one laser. So we can titrate the dosage of each and every laser and get the best results that can be done in our type of skin.
So those who have white skin and dark hair are the best candidate. Okay. I hope the audience are getting benefited from this session. Does laser hair removal lighten the skin?
Yeah, as such, it works on the pigment or melanin in the hair shaft. So if the skin is darker, it may lighten the skin a bit, and that is not permanent as such. It's a temporary effect over the skin. On the contrary, sometimes we get the hyperpigmentation. That is, if not done properly, or if the patient is not taking care, the do's and don'ts that we have already discussed, the skin may become hyperpigmented, or it becomes much more pigmented than the normal skin. So proper care should be done before and after laser, and it should be done only under the guidance of a qualified dermatologist to avoid any complication as such.
Okay. So does a laser treatment hurt?
It depends on the sensitivity of the person. It hurts a bit, but it's tolerable as such. But there are certain patients who are more sensitive. In such patients, we apply the anesthetic cream for a while before the laser, and then it becomes almost painless. Nowadays, the newer lasers, which are being used in motion, we call it, and we use less of fluence for a longer time and in motion. These lasers are much less painful, almost painless lasers. So newer editions of lasers are coming, which are almost painless. Otherwise, also there is not much of pain. It's like a snapping of a rubber band, which is tolerable.
That's amazing. Is using perfumes or any kind of sprays or sun exposure while laser, or what precautions should one?
Yeah, these are the important precautions.
Yeah.
As I said, perfumes or any application should not be done on the treated area few days before, few days after the laser. This may make the skin more sensitive, and the chances of complications may increase. And the most important is the sun exposure. So if sun exposure is there before the laser, it may lead to tanning of the skin. The skin becomes darker, and so the absorption of the laser by the hair is reduced, as the surrounding skin is also darker. So this, we don't get good results in a tanned skin. Usually we avoid doing laser in a tanned skin. And same applies post laser also. So sun exposure should be avoided post laser also, because the skin that has been laced may become dark if if it is exposed to the sun. So for getting the best results, we have to follow all these do's and don'ts and all the precautions to be taken. And to avoid complications, we have to follow these instructions that are given by the dermatologist before and after lasers.
Audience, as the doctor said, we need to limiting direct sun exposure or take precautions at least 2 weeks before the treatment, because it makes the skin more sensitive to heat. My last question is, are there any disadvantages to laser hair removal?
See, as such, there is no contraindication to laser hair removal. So laser hair removal, first and foremost, the diagnosis is very important. There are two types of excessive hair growth. One is hypertrichosis, other is hirsutism. So hypertrichosis is growth of excessive hair in any part of the body that is usually genetic or related to some disease. And hirsutism is the case where we are doing laser on day-to-day basis, is the excessive growth of hair in a male pattern in females. That is especially over the face in the chest area. So in cases of hirsutism, we go for investigations before doing laser. Hormonal profile is done. Is there any excessive hormone, especially androgens? And sometimes this is more in cases of PCOD. So we go for ultrasound examination to detect if there is polycystic ovary in the female. So if this is taken care of before doing laser, the results are excellent. Then there are certain complications post laser if not done properly, like erythema and little swelling is there. That is common in all the patients, and it subsides with treatment, with application of ice or with application of a mild steroid. Otherwise, if higher fluence is used, there may be more of pigmentation, dyspigmentation we call it. There may be scabbing, there may be crusting, some burns may be there, and even scarring may be there. So it's very important that it should be done under guidance of a trained physician or trained dermatologist. And sometimes in the laced area, sometimes we get more of hair growth around the area that we have treated. Sorry. This is called paradoxical hypertrichosis. So I'm implying again and again that it should be done under the guidance of a trained dermatologist. In such a case, this type of laser hair removal is absolutely safe, no complications as such, as this is the most practiced cosmetic procedure all over the world. It has been done on regular basis, and we have found very excellent results without any sort of complication.
Okay, let me check if we have any questions from the comment section. So there is one question, doctor. Does having tattoo make any difference while treatment?
See, it's a very important question. As such, tattoo means already the pigment has been introduced in the skin. And if we are lasing on the same area, it's not that easy to get rid of the hairs over that area because the same laser will be absorbed by the tattoo also. But then there are two different types of laser that are used to remove tattoo and that are used to remove hair. In the tattoo part, we use Q switch laser that breaks the tattoo particles and remove them. And in cases of laser hair removal, we use the long pulse laser. So if the hairs are over the tattoo area, it's not that easy to remove that hair. On the contrary, sometimes we may hit the tattoo to produce inflammation and burn. So it needs a proper examination and should be done under care of a qualified dermatologist.
Okay. So, doctor, any words for our audience?
So for the audience, I'll say that it's a very safe procedure, nothing to worry about. And if all precautions are taken, if we are under a qualified dermatologist who has already ruled out any hormonal irregularities, menstrual irregularities, has done all the prerequisites before doing laser, and has referred to you to a endocrinologist if there is any abnormality, and you are doing laser under treatment. If the treatment is going on and we are going for laser hair removal, then the results will be excellent without any sort of complications.
So before ending this session, let me remind our viewers that eGlobalDoctors have started a new diet consultation as nutrition and health. We have a variety of featured categories as diabetes remission, detox program, weight loss, child nutrition, gut health, menopause nutrition support. Register with us today at eGlobalDoctors.com and book your appointment to get a proper nutrition coaching. Thank you, Dr. Manish, for providing such useful information about the laser hair reduction. Viewers, our Dr. Manish aim is to provide comprehensive care in dermatology and advanced management of various skin, hair, and nails disorder with promising results. If you need any help or guidance for laser treatment or skin problems, you can connect to our expert on eGlobalDoctors.com. Thank you, doctor.
Thank you. Thank you, Divya, for having me on this platform. Thank you.